First of all, everyone should have an abdominal ultrasound once a year. What is an abdominal ultrasound? As a rule, this is an ultrasound of the digestive system because many disorders can be asymptomatic. In other words, a person might feel a twinge in the right upper abdomen, experience some pain, diarrhea, or constipation. But usually, people don't pay attention to these symptoms. But these are very important symptoms for early diagnosis. That's why, whether you have pain or not, you absolutely must get an ultrasound of the digestive system once a year. An abdominal ultrasound is indicated for cholecystitis, pancreatitis, intestinal dysfunction, liver diseases, and for any disorders or diseases of the spleen. And there's more good news for patients. Now there is an ultrasound for the stomach, so in cases of gastritis or duodenitis, for example, you can definitely get a stomach ultrasound. A lot of patients come to me and are afraid, they're afraid to go to a gastroenterologist because, as they tell me, they'll immediately be sent to swallow the tube. That's it. But there's no need to be afraid of that. Gastritis is perfectly diagnosed with ultrasound. If we do an ultrasound and an ulcer is detected, then yes, in that case, the patient is sent for a fibrogastroscopy, of course. But ulcers are actually diagnosed in about, 10, at most 15% of the patients who come to us. And about 90% get by with just a stomach ultrasound, so patients don't need to be afraid and can calmly come in for a stomach ultrasound. Ultrasound, not just of the stomach, but of any part of the digestive system, is done on an empty stomach. That is, the day before. You shouldn't eat foods that cause bloating of the intestines. That means legumes, fresh fruits, fresh vegetables, and large amounts of sweet. That's the first point. Second, ultrasound can be done either in the morning on an empty stomach or, in principle, 4 hours after eating. As a rule, why do they say on an empty stomach? Because the gallbladder contracts and after eating it simply can't be seen. Basically, digestion takes place within 2 to 4 hours and the gallbladder can be seen perfectly. You have a new modern machine and in our clinic we have new modern one, so the entire digestive system is clearly visible. The gallbladder, the liver, the intestines, the stomach, the spleen and the pancreas. Everything is clearly visible. The procedure is absolutely painless, harmless, and safe. There is no radiation at all. So first, a special gel for ultrasound is applied, and then the doctor examines you. On modern machines like the ones we have in our clinic, in addition to the organ itself, you can also see the organ's blood supply. In other words, it shows the blood flow. This is very important. For example, for diagnosing and distinguishing polyps from gallstones, it's crucial to observe the presence of blood circulation. In cases of certain cancers, the lymphatic system of the abdominal cavity is also examined, which is very important for the early diagnosis of some oncological diseases.